right? Yesterday, when we left off, right? We left off on type 1. I hooked it up very nice. So now we are on page 553, right? 553, right? So we can talk about it more, right? Okay, so let's go. Yesterday, I said the normal process, right? We have two types of diabetes. We said type 1, type 2. I said the normal process, let me give a good marker. Come on. The normal process works like this. This is yaya. You eat whatever. We're going to use Dunkin' Donuts, right? It turns into sugar, which I call fructose, right? This sugar goes to the blood, right? The pancreas detects this sugar and secretes insulin that pick up this sugar, put 50% as saved, so we're going to call this the bank, and then the other 50% to the body. Now, that's the normal process, right? Now, I told you insulin has two jobs. Guys, please don't talk. Please. I told you insulin removes sugar, right? Plus potassium. Okay? Now, I said when you have type 1, I told you it is genetics. You're born with it, kids have it. I also said 2 can go to 1. 1 will never go to 2. I said that. Now, I said when you are diabetic, type 1 or type 2, I basically focus on type 1. You have polyuria, right? Polyuria, the 3 P's, polyphagia, and polydipsia. And we also talked about the insulin. Now, page 553, before I go to type 2, let's talk about what type 1 and type 2 have in common. Type 1, your diabetes, you're missing the insulin. Type 2, you're diabetic, but how you became diabetic. Not all over obesity, abdomen obesity up here. So when you type 2, it's because you are obese, abdomen area, right? So therefore, when you are type 2, the problem is not a pancreas problem. Type 2, the problem is this. Look, you eat Dunkin' Donuts, it turns into sugar. The pancreas do secrete insulin. Yes, it does. So it produces insulin. Insulin pick up the sugar, but it have nowhere to put it because the cell is broken. That is type 2. So therefore, when you're type 2, we give you PO meds, which I'm going to talk about, list of them. Right? Now, what does diabetes type 1 and type 2 have in common? Both of them have in common high sugar in the blood. Let me show you how. Type 1, I didn't tell you signs and symptoms. I'm asking you what they both have in common. What do two Haitian people have in common? They Haitian. What do two diabetic patients have in common? Both have sugar in the blood, but for different reasons. So, type 1, sugar is in the blood because when I eat, the pancreas is not working. So the pancreas does not secrete insulin. True? Type 2, there's sugar in the blood because when I eat, the pancreas do work. It secretes insulin, but the insulin has nowhere to go. So type 1, type 2. What do they both have in common? High sugar in the blood, which is called hyperglycemia. Row 1, any question? If you don't understand that, we can't go on. Row 2, question. Row this way, question. Row 3, lady from the green shirt all the way to the pole, question. Over here, Linda row, question. Yes, Katuska. Okay, all right, let me ask the class. What she's saying, there's a lot of people that got it, and because you got it, when I do it, you tends to talk. What she's asking is please don't talk so she can try to get it. All right, please? So let me do it again. Okay, don't talk. Now,
I have a question, Ms. Tony.
you have a question? Yes.
You said type 2.
If you, hold on, I'm going to do it and then I'm going to answer your question. I'm doing it over. Ready? Normal. You eat whatever you want to eat. It turns into sugar. DD means Dunkin' Donuts. Turn into sugar. The sugar we call fructose, sucrose, right? Sugar. It goes to the blood. Right when the body detects the sugar in the blood, pancreas secretes a hormone. Why do pancreas secrete the hormone? Because the pancreas detects the sugar in the blood. That hormone is called insulin. Insulin go pick up the sugar from the blood, put 50% to save, like a bank, be quiet, and 50% to the bottom. That's the normal. When you have type 1 diabetes, which is genetic, what is wrong with you? The pancreas do not work. How? You eat, I have this now, I eat rice or Dunkin' Donut. It turns into sugar. The sugar goes into the blood. So now there's high sugar in the blood. True? Now, the pancreas is supposed to secrete insulin, but the pancreas does not. So therefore, there is sugar where? In the blood. Right? So because you got sugar in the blood, we give you insulin. Period. Type 2, diabetes, the way you get it is obesity, abdomen obesity. You have it because of bad diet. You eat Dunkin' Donut, it turns into sugar. The pancreas detects the sugar, set insulin. Insulin pick up the sugar, because that's what it do. However, it has nowhere to bring it because the cell is broken. So all the sugar stays in the blood. So what type 1 and type 2 have in common? Both have high sugar in the blood for different reasons. Type 1, a pancreas issue. Type 2, cell is broken. If you don't understand that, it ain't have nothing to do with being loud. We need to meet privately because it was a very quiet room. Yes. No, the sugar does not go in the body. It stays in the blood. So you gotta give the patient pills to open the cell. Yes.
The paper still work the blood enough?
Yes, some school teach you that. No, let me explain something to you about that. She just said the pancreas work, but not enough. Let me explain something to you. My mom type 2 diabetes. She went to Haiti, she didn't do nothing she was supposed to do. When she came back, the doctor said, hey, we're gonna remove you on metformin, now we're gonna put you on insulin. So she went from 2 to 1. Now you can say the pancreas is working, but not enough. Because she had this, she didn't do what she was supposed to do. Now she is in here. Type 2 can go to 1. Yes.
I thought type 2, the cell is broken, so when insulin picks up, when the insulin picks up the sugar, it doesn't have anywhere to store it, so it's spilling into the blood. Is that what it does?
That's the same thing. The cell is broken.
So
Yeah, but look. Type 2 is. Type 2. It has nothing to do with the insulin. The only time type 2 insulin has to do with it, 4523. That's where the office at.
That's what the office is?
Please, thank you.
Well,
Okay, let me say something. Type 2 has nothing to do with the pancreas unless the patient went sour. That means the patient went from having a cell problem to the pancreas. Anytime you have type 2 diabetic patient, we don't put you on insulin unless you was type 2, the situation got bad. The only time we put type 2 patient in insulin in pregnancy, because if we give you metformin, mommy going to bleed to death.
So in type 1, the pancreas does not secrete insulin at all.
Yeah, that's why we give you. In type 1, the pancreas does not secrete insulin at all. So I give you insulin. In type 2, it does secrete insulin if the cell is broken. Now, type 2 can go to type 1 where you have two problems. You got cell problem, type 2, look. Type 2, the problem has nothing to do with the pancreas. That's it. Period. Nothing else. Now, when is the pancreas is involved? Let me tell you. The patient is a type 2. We put her on metformin. She don't take it. She eat whatever she want to eat. She don't diet, nothing. Now the pancreas stop working. So we remove her from metformin and we give her insulin. Period. Yes.
When you have type 2, if you do what you're supposed to, is it a possibility to go to type 1 following the regimen?
No, never. If you have type 2, you do what you're supposed to do. You lost all the weight, you do get a gastric bypass, hell, you don't have diabetes no more. Type 2 is reversible. Type 1, never. If you became a type 1, but you was a type 2, so you were type 2 and you became a type 1, and you go lose the weight, you don't have 1 or 2. If you're born with type 1, you can lose all the weight you want. You still have it. The problem is the pancreas. I can't break this any smaller. Yes.
I have a question, Ms. Sonia.
Uh-huh.
Is
Shh.
it possible for a patient that just went like from insulin to no pill, no insulin?
Yeah, I just said that. I just said that. I just said that. My mom, she was on metformin. She didn't do what she was supposed to do. She went to the LVN, ate what she wanted to eat. She came back, they poof, took her off metformin, go give her Lantus. She said, oh, I don't want to PK myself. She don't want to stick. So the doctor said, I need you to go lose 7,500 pounds. She lost 100 pounds. She don't take metformin, she don't take insulin, she don't take nothing. Because she wasn't born with diabetes, she got it because obesity, then she lost the weight. Diabetes type 2 is reversible. Yes, yes. Question. Somebody said they got a question. Okay, we cool, period. Who? Yes. All right. All right, we're going to keep on moving. Okay, let's go. Now, okay, now we're going to go to 570. Remember, you're going to have 577 and 553. You're going to be on 2 pages. You're going to fold 553, 577. Fold. 577, yesterday, we did the insulin. Now we're on page 577. We're going to do the hypoglycemic, which the PO drugs. The PO drugs, that means these are the drugs we give for the Monique, it don't work like that. There's a chair right here. Monique, you ain't going to disrupt my class. Let's go. When we give PO meds, we give PO meds because the cell does not work. Right? So let's go. The PO meds are given, PO means by mouth. The pills are given to fix the cell. Everybody say that. PO meds are given to fix the cell. Ready? Let's go. Box 4511. Ready? The sulfonylureas, Emerald. I don't want you to know all of them. I want you to know the top 200. Emerald, 575, box 4511. 575, 4511. Look, you don't got to talk to find me. Right? 4511. Sulfonylureas are Emerald, Glimepiride, and you need to know brand and generic, Glipizide, Glyburide, right? Then we go to Biguanidine, top 200, metformin. Metformin is the mama papa of the mama papa. Go down. Then we go into glucose, glycette, Actos and Avendia, and Miss Sonia said you need to know brand and generic. Brandon, I don't care about Starlix. It's still out there, but it's an old drug. And they go to baby metformin, Januvia. Now, all of these oral hypoglycemia drugs cause bleeding. all of them cause bleeding. Anytime you're going to have surgery and you are a diabetic patient taking PO meds, you must stop the drug 48 hours before and 48 hours after. Again, anytime you're going to have any surgery and you are a diabetic patient, you taking PO meds, we have to stop it 48 hours before, 48 hours, because all of them cause bleeding. Any question? Now, all of these drugs, right, they call them oral hypoglycemia. I want to talk about metformin. Anytime you are taking metformin, metformin will cause you to lose weight. But it is not used as a diabetic pill, as a weight loss pill. Metformin is the top 200. It's very fat. 500 milligrams is the lower dose. You can take 1,000 or you can take 500 milligrams. One a day or you can take twice a day. Now, metformin, I told you, causes weight loss. Also causes diarrhea. But there's something metformin does not supposed to do. You know when you get a flu shot and your body aches? That is called lactic acidosis, which is a medical emergency. Anytime someone takes metformin and the person says, oh, I can't move, my body aches, hey, you got to stop it right away. Now, if I give you metformin, right? Metformin, Atos, all the lists that I call. If I give it to you and I don't give you food, you will go into what? Hypoglycemic crisis. So all patient who's diabetic, you at risk for two things, either hyperglycemia or hypoglycemia. Any question? We cool? We cool? We cool? All right. Now, we go into page 553. Okay? 553. We go into the disease. Diabetes mellitus has to do with the pancreas. True. Diabetes mellitus, Miss Sonia tell you it can be type 1 or type 2. Normally in type 1, the patient will be skinny. Normally in type 2, the patient will be obese. Right? Now, all of diabetic, type 1 or type 2, it's sugar in the blood. True, but for different reasons. The patient will have polyuria, PPP, polyphagia, right? Polyphysia. Now, diabetic patient, some of the signs and symptoms of the patient having diabetes. This is early sign of diabetic. Women, you come home and in front of the door, you start itching, infection, gluten, UTI that doesn't go away, early sign of diabetic. Your feet burn, not itch. Your feet burn. And you say, oh, I can't even feel my feet. Early sign of diabetic. Women, your early sign of diabetic is UTI every week, infection. Every week. All right? Now remember, type 1, you will lose a lot of weight. Type 2, you gain a lot of weight. Right? All of them, polyuria, polyphagia. The reason you have the 3 P's, guys, and the school teach everybody the 3 P's, it is too much sugar in the blood. When you have all this sugar that's in the blood, and the sugar is not removed or doesn't circulate like it's supposed to, that brings people in stroke, heart failure, hypertension, renal problem, you got eyes problem, right? All peripheral neuropathy, you can't feel your hand. You put your hand on the stove, you don't even know if it's hot. You cannot walk barefoot. So a lot of people say, how come they say diabetes, the patient have heart failure? Because the sugar turned like a cake, a paste in the blood, sticks to the blood, which then put the patient in MI, which put the patient in heart failure. It makes sense, right? So that's why when they tell you you pre-diabetic, ooh, that's what Dr. F. That's where I'm going. I'm going to go, bam. Katuska like that. Right? Any question? Right? Wake y'all up a little bit. Now, students say to me a lot, Miss Sonia, if type 2 is caused by sugar, why when your sugar low, you eat sugar? You don't get it? People say, oh, they say, black people, they say, girl, you better stop eating that sugar, you gonna get diabetes. Poor soul. Why? If diabetic is because I have high sugar in my blood. Why? When I go to hypoglycemia, why do they give me sugar? Because the sugar is what? Low. Because listen, if I'm giving her insulin, what is the insulin doing? Taking her sugar. So that means in her blood, sugar is what? Low. And that's why when someone goes on a treadmill to exercise, when you exercise, you are losing weight. The more you lose weight, the lower your sugar is. So you come on the treadmill, 3 days a week, and I give her insulin, where am I going to find her? Because exercising causes your sugar to go low. That's why anytime you diabetic, you go work out. You don't give the lady insulin, you give her what? A snack. Because you know as you exercise, your sugar go what? Down. It make good. It's good, right? Any question? So diabetes mellitus, make sure you know that I'm on page 553. You are responsible for 7A, A1, A2, A3, which is diet. Okay? Carb is white, true? White stuff. Carb give you energy. A lot of carbs make you what? Ooh, carb is white. White bread, white pasta, sugar. Make you fat. And that's why, but when you diabetic, honey, you need some fat. You don't want to be a lot of fat, but you need some fat. You can't just tell people, don't eat no carb at all. That's not good. Dr. Atkins, poor soul, he died. He tell people just eat big greasy stuff, and that's how you lose weight. All these people are dying of heart problems, right? You see, so carb, they tell you carb. The reason because the carbs also have sugar in it. Because when you were diabetic, you got 2 problems. One, you have high sugar. Then, when we give you the medication, you got low sugar. Now, late sign of diabetes. You ever seen somebody's toes? You seen the toe? Wolves. The toe is not black. Anytime it's black, you pass diabetes. How you know a person has diabetes? Their big toe, if you do, it sounds like a cricket. And it's white and crusty. If you wear no matter how much pedicure they do, it's still gonna look right. right? And it's hard. Move the toe. It's white and it's hard. Anytime the big toe is blue, you pass. Now it's not aquatic. Big. Diabetic patient. Where is the ulcer? Malingia, right? So NCLEX to give you this here, right? This is the toes. Isn't that cute? Right? Right? The diabetic patient, the ulcers is normally in, not here, not here. This is a vein problem. Here, on the toes, look, on the toes, you see the people, everybody on your toes, you got hair, true? Anytime you see the patient on their toes, they don't have hair and they got ulcers, this is a heart problem. And it's called PAD, what's my lingua? Diabetic patient. The ulcer, this is under your feet, right? This is the heel, either here or under plantar. That's diabetic. So guess what NCLEX do? They give you the foot. They give you the foot and they ask you what medication. And you always get in trouble. Anytime you see ulcers, on the toes, this patient take Plavix because this is a heart problem, right? Heart. Okay, uric acid problem, the big toe, only the big toe, and that is called gout, right? But PAD, peripheral arterial disease. I taught you that in cardio. Lower maling sukisa on the toes. Diabetic, the ulcer is either in the heel or the plantar. That's a diabetic patient. So NCLEX can give you the maling, the ulcer, and say what's your nursing intervention or what drugs you give. You got it? This one here, Plavix. Let me spell it. For the toes. If it's diabetic, which is right here, we give insulin, Piomed. Y'all getting it? And the vein is worse. Let me ask you a question. Who normally get it in the vein? Young people. And 99.9, anytime you see young people have ulcer on the vein that doesn't heal, check for breast cancer. My land. Yeah. Plavix for peripheral arterial disease, right? Plavix. When you see a young person on the calf, not the calf, but block, the side, you see they got an ulcer that will not heal, go do a check for breast cancer. Okay? And insulin under, because it's diabetes or the plantar. Now, all of this can cause us to amputate. If you have PAD, we're going to amputate. If you have also here, we're going to coupe, amputate. Yes?
On the breast cancer, can the cancer come before the ulcers or the ulcers will show after the
A
cancer?
lot of time, you can have them both together. And a lot of time, she never diagnosed with breast cancer. And the chemo will cause ulcer spread real bad. But they relate. And not only that, they bone to calcium drop are just a whole lot of problems. Okay? And young women have this. Young women, modeling, no matter what, that they don't do. Any question? We cool? Now, both, this can cause us to amputate, this can cause us to amputate. This can cause us to amputate because you have also in the leg walking around here, they can clip. It can turn gangrene, spread, go to the blood, sepsis. So we need to get rid of the leg. All of them can cause amputation. A lot of people say diabetic patient get amputation, but if I don't know circulation and peripheral arterial disease, I'm gonna cut the leg too. Yes? That, okay, macrovascular complication is all of the things that can happen because of diabetic. Eye problem, kidney problem, peripheral neuropathy, I said eye, kidney, heart problem, all the different organs that is affected. Yes, good job. White dot blood pressure patient, you can donate organ. Patient who's diabetic, we don't want your organ. You know why? Because your kidney is no good. That's no good. Yeah, that's big. Blood pressure will take your heart. We'll take a liver. We'll take kidney. We'll take a lung. Yeah, blood pressure you can donate. AIDS don't donate. Lupus don't donate. MS, they don't. Myasthenic gravis, no, nobody don't want your stuff. Hey, here's the NCLEX question. Mental health, do we take the organ? Yes. Mental health has to do with chemicals in the brain.
What they do with?
We'll take, yes. You don't take the brain. No one's supposed to open here. Okay, any question? Yes, question? Okay, so we talked about diet and exercise. Very big on NCLEX. The more you exercise, the less insulin you need. You got it? Did y'all understand that? Sister, you got that? The more you exercise, the less med you need, the less insulin you need. Because when you lose weight, your insulin need, the demand for insulin is not needed. I'm pregnant, watch. You see, when you pregnant, you cannot go in metformin. We know that. Why? OB student. Metformin causes placenta erosion. Yes, and when you are pregnant, your demand for insulin is higher. So when you are pregnant, we give you higher dose of insulin. When you have baby, your insulin demand go down. Because the body not under stress. Pregnancy, the body is under stress. You got it? Any? Yes.
Is it true if you take metformin, this is if you want to get pregnant, is it true that you can take metformin and it'll like boost your, the time you
No. Okay. If you want to get pregnant, you will take a drug called Propanol. Now, what happened with those drugs, you at risk for double babies, twins. Some people want twins because you want to get fat one good time. So celebrities take that. Not because they want twins, it's because they want to get pregnant one time. If two come out, good. So you don't have to go through it again. Right? Any questions? So for exercise. Now, number 5. Oral hypoglycemic medication. We talked about. That's the metformin for type 2. All right? Turn. Now, anytime you give, when you're diabetic, Sonia said you take type 2. When you type 2, you take Med. When you type 1, you take insulin. True? Now, here is where your NCLEX questions come in a lot. B. I'm going to do, everybody should be on B. 534B. Complication of insulin. Again, look, stay with me. No. Be quiet. I'll help you. Ready? Go back to 553. Everybody go back to 553. Stay with me. Right? Look. You are responsible for 7A, diabetes mellitus, description. 7.2, data collection. 7.3, diet. Then I did D, carbs. Then I did 4, exercise. Now I'm on 5, oral hypoglycemic med. I said, when you're type 2, you take PO med. That's what oral means. Now turn your page, 554. Now you in 6. When you type 1, you take insulin. You see that? So you're responsible to read all those so far. Now, here, then I said, here is where your NCLEX question come in deep. And these are complication of insulin. I want you to write a little mark for me, and I'm going to go over this theory. B, I want you to put local reaction. I want you to put NCLEX. Just put. I'm going to talk about it. 2, insulin lipodystrophy. I want you to put NCLEX. 3, insulin resistant. I want you to put NCLEX. 4, I want you to put NCLEX 6 times. 4, Don phenomenon, or circle it big. Make some stars. Draw a picture. You will see this on NCLEX, and I'm going to talk about it. 5, I want you to put, make some stars. Okay? Ready? Now, when you take insulin for type 1, true, insulin has certain complications. The first complication of insulin is local allergic reaction. You remember yesterday I did this, and I said when you give insulin, you want to change spots. Remember? Because you at risk for local redness. Ready? Redness, swelling, and tenderness. Induration or wheal at the site of the injection may occur 1 to 2 hours. Reaction usually occur during the early stages of insulin. Yes, anytime you're a newly diabetic patient, you teach them how to give the insulin, they're at risk for this. Instruct the client to clean the skin with alcohol. These are complications of when you are administering the insulin. Number 2, insulin lipodystrophy. There's 2 types, lipoatrophy, lipohypertrophy. Lipoatrophy is a loss of subcutaneous fat, and it appears slightly different. Let me explain to you. When you use the same spot all the time, this lose muscle tone. That's why they want you to change spot when you give the insulin. That's that. B, lipohypertrophy is the development of fibrous fatty masses as the injection site. That's why they tell you, instruct the client to avoid injecting insulin into affected site. How do NCLEX ask you this question? You're going to say, which one the patient says she needs further teaching? When she said, I can stick myself in the same location every day, she needs further teaching. All right. Okay. Continue. Insulin resistant. The client who's receiving insulin develops immune antibodies that bind the insulin, decreasing the insulin available use in the body. When you give yourself so much insulin all the time. So the amount that the doctor orders does not work for you. That's anything. When you take too much laxative, it do the opposite. When you take too much insulin, it do the opposite. You got that? When you take too much drugs, opiates, PAM, you need more for you to get the feeling that you're looking for. That is called tolerance. Okay? Make sure you know that. Here it is. My baby. So, just remember, Sonia, so. Remember that. That's how I remember that I was in Nova. Anytime you are diabetic, type 1, and you taking insulin, you, all of us, we automatically have 2 complications. I don't care, you the best diabetic patient. I don't care, you good. There's 2 complications, and it's called Don phenomenon. The other one called Samagio. What does that mean? Every time I check your sugar in the morning, it will always be high. Because the doctor knows that when the doctor orders insulin at night, diabetic patient always get a what? Snack back. That is for Don. When you diabetic, we all who using insulin type 1 is at risk for a complication called what? Samagio. So every 2 o'clock in the morning, you will see the patient's sugar drop because the doctor knows that every diabetic patient will get what bag? Snack bag. So why do we get this snack bag? For 2 reasons. 1, ready? Don phenomenon. Because they know your sugar will be high in the morning, so they give you insulin. And anytime we give you insulin, we must give you what? Food. That's 1. Now, another reason is we know your sugar going to be low, so that's why they give you what? Snack bag. So that is why all diabetic patients get a what? Snack bag. Any question? So anybody have any question with Don phenomenon and Samagio effect? S-O, low. Don mean early, well, Don really mean low. But the way you remember, so low. So low. Don high. Don high, so low. Yeah, Don, no, not Don make it high in the morning. No, let me re-say it. Mommy, hold on, chill out. I don't want you to say Don make high low. I want you to say all diabetic patients who is type 1 and who's taking insulin, there is 2 complications. In the morning, the sugar will be high. Because the doctor knows that in the evening, we will give them insulin. And because we give insulin, we give a snack back. Done. That's it. All diabetic patients who's type 1 taking insulin, another complication is 2 to 3 o'clock in the morning, their sugar will drop low, so they have a snack bag. Don't go say Don make. That's not what I taught you. Shh. Yes.
Why would they give them Lantus?
The reason they give them Lantus at 9 p.m. because Lantus does not have a P. No, well, local stuff flow like butter. Yes, mommy, did I answer it?
Yes,
I know I did. I knew I would. Any question, Mom, did I answer? Yeah, I know I did. Who else want me to answer? Yes, Christine Katuska, yes. You caught that one because you smiling. Barbie doll. Any question? We cool? Nah. So anytime somebody asks you, what is complication of patient who's taking insulin? Miss Sonia didn't say Dawn phenomenal is a complication of patient who have diabetes. That's not what I said. I said Dawn phenomenal and Somagio and injection are patients who are tired. All right. Y'all got it. You feel the license. Oh, it's coming. The license is coming. Imagine we kill our med surge like that. We kill OB like that. Honey, you ain't gonna be. They can't touch you. You'll be bad. But you gotta do your part. You gotta do your part. And we're gonna do better with being quiet. I'm on it. When we quiet, the stuff pretty. But when you calm down, we're gonna work. I'm gonna get mean again because I got better. I had to pray about it. So get back. We need to be quiet so people can marinate, let stuff up there nice. All right? Any question? We cool? All right. Here's your calendar for next week. You're tired. Imagine me, I'm tired too. Right? Let's go. Your teacher crazy, just like my student. We crazy together. Okay, so let's go next week. Let me see how good you are. All right. Watch. Next week, we are continuing on endocrine. What is this? Peace, growth and development part 2. Y'all just awesome. Growth. Okay. Now, Thursday. Right? Now, fundamental, we did electrolytes. So fundamental for next week is nutrition, diet. What diet? What clear liquid? Full liquid. And med-surg, endocrine. By next week, endocrine will be done. Any questions? Okay. Now, we cool? Okay. You people just stay put so I can show you how to study. Old people, if you can dismiss yourself.